Welcome to this unit on AI and cybersecurity. By the end of this unit, you will be able to outline cybersecurity issues relating to AI for health. Safety of AI technologies. Patient safety could be at risk from a use of AI that may not be foreseen during the regulatory review of the technology for approval. Errors in AI systems can cause injury to a patient or a group of people with the same health condition, for example through incorrect recommendations, such as which drug to use, which of two sick patients to treat, and recommendations based on false negative or false positive results. Model resilience, or how an AI technology performs over time, is a related risk. Healthcare providers also commit human errors, such as error of judgment. However, the risk with AI is that an error, if fixed in an algorithm, could cause irreparable harm to thousands of people in a short time if the technology is used widely. Furthermore, the psychological burden and stress of such errors is borne by the health providers who operate such technologies. An AI application, like any information technology system, can also provide the wrong guidance if it contains code errors due to human programming mistakes. For example, the United Kingdom NHS COVID-19 application, which was designed to notify individuals to self-isolate if exposed, was programmed incorrectly. A user of the application had to be next to a highly infectious patient 5 times longer than that considered risky by the NHS before being instructed to self-isolate. Although up to 19 million people downloaded the application, a shockingly low number of people were told to isolate, thereby exposing themselves and others to risks of COVID-19 infection. It is also possible that a developer designs an AI technology unethically to produce an outcome that would generate profits for the provider or conceal certain practices. Malicious design has affected other sectors, such as the automobile sector, in which algorithms used to measure emissions were programmed to conceal the true emissions profile of a major car manufacturer. Use of computers carries an inherent risk of flaws in safety due to insufficient attention to minimizing risk in the design of machines, bugs or flaws in program code, the quality of data sets used to train algorithms. Injuries and deaths due to such flaws are underreported, and there are no official figures and few large-scale studies. In one study in the United Kingdom, for instance, it was estimated that up to 2,000 deaths a year may be due to computer errors and flaws, and that it is an unnoticed killer. Cybersecurity. As healthcare systems become increasingly dependent on AI, these technologies may become targets for malicious attacks. For example, a system could be hacked to shut it down, to manipulate the data used for training the algorithm, thereby changing its performance and recommendations, or to kidnap data for ransom. AI developers might be targeted in spear phishing attacks, which could allow an attacker to modify an algorithm without the knowledge of the developer. An algorithm, especially one that runs independently of human oversight, could be hacked to generate revenue for certain recipients, and large sums are at stake. For example, in 2017, the total global spend on healthcare was $7.8 trillion in 2017, or about 10% of global gross domestic product. The United Kingdom Information Commission Office noted that cyber attacks on the health sector are the most frequent. Health data is some of the most sensitive data about individuals, and security breaches could harm privacy and dignity and the broader exercise of human rights. A study in 2013 showed that 4 anonymized data points are sufficient for unique identification of an individual with 95% accuracy. Measures to avoid such breaches, which can be broadly categorized as infrastructural or algorithmic, are improving, although no defense is 100% effective, and new defenses can be broken as quickly as they are proposed. You have now completed Unit 10 of Module 4, ethical challenges. In the next unit, we will look at AI, labour and employment.